be seated. So, good morning, everybody. Welcome to the 53rd graduation of the College of Public Health. Yay! On behalf of all the faculty and staff of the college, I'm really honored to welcome you here today, even if I've lost my hat. This is a time when all of us, families, friends, faculty, all of us are here to celebrate the 1,189 graduates of the class of 2019. To mark today's significance, we would like to begin with a short video applauding our graduating students and everything that you have accomplished this year.
Today, we celebrate our 1,189 graduates in the class of 2019. You're among our highest achieving and most diverse graduating classes ever. You've come to Temple from across the country and around the world. You're graduating with 43 different degrees across our departments and joining our family of 35,000 alumni living around the globe. You're on your way to becoming leaders in your fields, and you are helping people live healthier, happier lives, solving the most complex health challenges, and building a better tomorrow for all of us. Today, we celebrate you and everything you've accomplished. Congratulations, class of 2019.
As you can see, the College of Public Health trains a very diverse group of students, but we're all united by our interest in health. And some of you may be only familiar with the small part of the college you attended, and that could be public health or health professions or social work or nursing or one of the many other things I did not mention. No matter what your discipline is, you are an integral part of a unique college, one in which many fields come together to transform how we think about and study health and how we will practice healthcare in the 21st century. Our mission here is to train you to become the next generation of health professionals and create new knowledge that results in all of us leading healthier lives. Now, you probably heard the old adage that if you don't have your health, you don't have anything. And for those of us who have experienced a serious illness or disability, you really know how true that is. But here at the College of Public Health, we know that health is more than just disease or just disability. Positive health involves your environment, your state of mind, and your behaviors. And those dedicated to the well-being of others can truly transform lives by improving each of these aspects of health. And that is why we are so proud of all the graduates who are sitting here today. We hope that we have helped to transform your lives so that you can go out and transform the lives of others. The United States is amongst the wealthiest countries on earth. And we see that some of our citizens are indeed amongst the healthiest in the world, but not everybody. Many others, including many who live right here in our community in North Philadelphia, suffer from preventable diseases, disability, and premature death. Americans suffer from more health issues than people in other high-income countries, and our children are 50% more likely to die before their first birthday. Think about that, 50% more likely here in this country. So we know that the zip code that a person lives in often determines their longevity. Many of our graduates will be addressing these issues as clinicians, educators, and researchers. As graduates of the College of Public Health, you are uniquely qualified to work as part of an interprofessional healthcare team to assure optimal well-being and quality of life for individuals and to reduce health disparities between populations. At the College of Public Health, we are working towards a world where everyone, no matter what neighborhood they live in, has the chance to live a healthy and productive life. So we are so proud that our graduates have chosen to dedicate themselves to these tasks, to these incredibly worthy goals. Today, we have 800 undergraduate students who received their diplomas. Some new graduates will soon begin their first professional jobs. Many others will be attending graduate school to earn the Master of Public Health, a Doctor of Physical Therapy, or another advanced degree. Yes, and congratulations to all of you who are going on to do that. In addition, we also honor the 389 master's and doctoral graduates who will become researchers, occupational therapists, epidemiologists, speech-language pathologists, policymakers, athletic trainers, and other professionals. Regardless of your degree, your program has required you to invest a lot of hard work. You have likely felt overwhelmed at times, but your intelligence, your commitment, and your desire to help others has carried you through to this point. These are the qualities that all of you share, and these are what will enable you to make positive change around you, whatever your next step is. Your time at Temple has not just been about studying, and no, I'm not talking about partying. Many of our students have to work part-time jobs. Sometimes they meet obligations to their families while pursuing their degrees. And because of that, I want to ask all of you to think about contributing to the college as you move forward, to lend a hand to those who are following in your footsteps. Each of you received an alumni pin prior to just the start of our ceremony today. We hope you'll wear this pin to show the world that you're proud alumni of the Temple College of Public Health. And as a reminder, to stay involved through the college with your alumni association and to lend a helping hand to those coming up behind you. We are so proud of everything you accomplished, and we know that this is really just the beginning of a great many things in your future. So now, it's my great honor to introduce our commencement speaker, Dr. Valerie Arkush. Dr. Arkush is chair of the Board of Commissioners for Montgomery County. She is a graduate of the University of Nebraska College of Medicine, and she received a Master of Public Health from the Johns Hopkins Bloomberg School of Public Health, which happens to be my alma mater, which is why I'm in this robe today. She completed her residency at Jefferson Medical College in anesthesiology with a special focus on obstetrics, and she's also has an undergraduate degree in economics from Northwestern University. Dr. Arkush has brought many innovative reforms to Montgomery County government during her time on the board. She's led efforts to eliminate street homelessness among veterans, streamline the delivery of human services, and she's helped to open up 10 new miles of recreational therapy across the county. Dr. Arkush oversees the county's multi-pronged, integrated response to the opioid epidemic. In 2015, she issued a standing order to enable participating pharmacies dispense the overdose antidote naloxone at the request of any member of the public. Before she entered public service, she was a professor of clinical anesthesiology and clinical obstetrics and gynecology at the University of Pennsylvania's Perelman School of Medicine. After obtaining her Master of Public Health, she also led the National Physicians Alliance, a nonprofit organization of physicians that was part of a broad-based nationwide coalition to advance comprehensive healthcare reform. She developed policy and legislative strategy, and she promoted public engagement around reform efforts in Washington, D.C., Pennsylvania, and throughout the country. Dr. Arkush's achievements show the critical importance of integrating the principles of public health and clinical practice, which is what this college is all about. Her work acknowledges the reality that individual health is shaped not just by traditional medicine, but also by our physical and social environments, as well as by government policy. At the College of Public Health, we too promote comprehensive understanding of health because we know it's essential for better health outcomes and greater well-being in our communities and throughout the world. So please join me in welcoming Dr. Liacouras.
Good morning, graduates. Thank you, Dean Siminoff, for that wonderful introduction and for inviting me to share this wonderful day with the Temple College of Public Health family. Thank you to the talented Temple faculty for guiding these students along their journey. Let's give them a round of applause. Thank you to the family and friends whose support helped make this day possible. Let's give them a round of applause. And most importantly, congratulations to the graduates. Today is a day to pause. Take stock of your accomplishments and celebrate. Tomorrow begins the time to grab your future and mold it. Think about what you are most passionate about and follow that dream. Be open to new ideas or career paths that hadn't occurred to you before. Transitions are never easy, but they also create opportunities for leadership and innovation. I know that the college has prepared you well to be leaders in your field and leaders in our community. Looking around at the graduates this morning, I know your future is bright. You are starting your careers at a transformational moment, one in which the difference between health and health care is finally starting to be recognized and studied. Never before has there been such a recognition and acceptance of the impact of factors outside of the exam room, like housing, food, and transportation, on an individual's health. But we have a long way to go to truly integrate this work. As you leave here today and embark upon your future, I urge you to carry 3 ideas with you. I believe these ideas are key not only to health, but to creating healthy communities. Number 1, look upstream. Number 2, focus on equity rather than equality. Number 3, mind the gap. So let me start with a story. 3 friends were walking in the woods. As they approached a stream, they heard children screaming. When they got to the riverbank, they saw children trapped in the water, heading toward a waterfall up ahead. One of the friends jumped into the water and swam out to the kids, trying to grab them one at a time to get them back to the shore. The second friend paused, tied 2 logs together, making a small raft, and then swam out to the kids. After a while, the number of the children in the water slowly started to trickle to a stop. The 2 friends looked up and they realized that their third friend was missing. A few minutes later, that friend came walking down the riverbank. "Where were you?" they asked. The third friend said, "I walked upstream to see why these kids were falling into the river in the first place and to see if I could stop it." We've come a long way since I was in medical school. I was taught to jump in the river or maybe to build the raft, and these skills remain very, very important. But today, more and more, we are starting to look upstream. For instance, we know that adverse childhood experiences can interfere with brain development, emotional development, weaken the immune system, and increase the risk of heart disease, diabetes, substance use disorder, and suicide. We know this cycle can continue to the next generation. But we also know that a trauma-informed care approach can break this cycle and create healing. It often comes down to knowing where to look for the problem. Frequently, it is not in the river right in front of us, but upstream. Second, equity and equality. Equity and equality are two strategies we can use in an effort to produce fairness. Equity is making sure everyone has what they need to be successful. Equality is treating everyone the same. Equality aims to promote fairness, but it can only work if everyone starts from the same place and needs the same help. Throughout much of my career in medicine, my experiences as a woman, a mom, a department chair, and most certainly in our public discourse, the focus has been on equality, on treating everyone the same. We were encouraged to be colorblind. But I now see that that may have been a well-intentioned mistake. In an effort to try to be fair, we often don't ask crucial questions. We don't approach a person in a culturally sensitive way. We perpetuate unconscious bias and structural racism. Let me give you an example. Your Way Home is a Montgomery County's innovative and award-winning program to make homelessness rare, brief, and non-recurring. Since the program began in 2014, we have reduced street homelessness by 47%. Not bad for government work. But the tragedy of homelessness persists in Montgomery County, and we set out to take a hard look at why. Poverty and a lack of affordable housing were certainly root cause issues, as they are in many affluent suburban communities across the United States. However, analysis of our own data uncovered a disturbing truth, that homelessness is disproportionately experienced by people of color. While people of color comprise 20% of the general population in Montgomery County, they make up 59% of people experiencing homelessness in the county. We also learned that Black individuals pay 15% higher rent and earn 8% less income than their white counterparts, suggesting a potential barrier for Black individuals and families as they strive to avoid or exit homelessness. Additionally, our race-blind approach does not acknowledge unconscious racial bias. Despite our dedicated staff believing that they treat everyone the same, one of our clients observed, and I quote, "White families get moved, get helped, get out of shelter quicker. White case managers help their clients faster." So let me repeat. Equality aims to promote fairness, but it can only work if everyone starts from the same place and needs the same help. Equity is making sure everyone has what they need to be successful. Number 3, mind the gap. I take the train back and forth to Washington, D.C. several times a year. Often as the doors are opening, the conductor reminds us to mind the gap between the train and the station platform. Every time I hear that announcement, I think, really? Does he really think we're going to forget? And yet, it is often the day-to-day things right in front of us that are the hardest to see. We now know that the zip code in which we are born can predict how long we are likely to live. From Spring Garden to Mantua, about a 15-minute drive, life expectancy differs by 20 years. The United States has the highest maternal death rate of any country in the developed world, and it is higher than the rate in some of the developing countries as well. According to the 2018 report of the status of women in the states, women in Pennsylvania earn 78 cents for every dollar the comparable man earns, and at current rates won't reach wage parity until 2068. If you dig a little deeper, you'll find that African American women and men earn substantially less than their white counterparts. And while the numbers are slowly improving, Blacks and Hispanics of any race are overrepresented in U.S. prisons compared with the racial and ethnic makeup of our population. These are just a few of the many examples of the gaps right in front of us that each of us encounters every day. The gaps are a proxy for many things: inadequate education, insufficient income, violence in the home or the community, inadequate access to health care, and the cumulative impact of systemic racism and other forms of prejudice. But we have the tools and the resources in this great country of ours to eliminate these gaps. We just have to use them correctly. Today, I'm calling you to action. I am asking you to join with me and commit to this work. I left clinical medicine because when I finally looked upstream, I realized that I could not write a prescription for what my patients really needed in order to be healthy. Over time, I have come to understand deeply that equality falls short of the goal. There is no one-size-fits-all solution for any of the challenges in our communities. Most importantly, I have learned that the best way to find the equitable solution is to simply ask the person or the community I'm trying to assist, what do you need to succeed? I guarantee they will have an answer, and it is in partnership that we move forward. The gaps will begin to close when we collectively take these steps, but we must always mind the gaps. Keep asking the hard questions and keep checking the data. Gaps quickly become invisible if we choose to look away. I know that each of you will use the unique talents and skills that you possess to build successful careers. But I urge you to never lose sight of the needs of our community as a whole. Find ways to make a difference outside of the workplace. Volunteer, serve on a board, mentor a student like yourself, fight for a cause you believe in, run for office, and most importantly, vote in every single election. Working together, we can create an inclusive, respectful, and healthy community. These changes won't happen overnight. It's a journey. I hope you will boldly step out and join me at the river. I'll be looking for you upstream. Thank you.
Thank you, Dr. Akush, for joining us today. I think she really captured the spirit and the goals of the college and of all of you, and I really want to thank her for that. It was inspiring. And now, I'm pleased to introduce our student commencement speaker, Laura Baer. She's graduating today with a Doctor of Physical Therapy. After earning her bachelor's degrees in dance and neuroscience from Muhlenberg College in 2012, Laura decided to become a physical therapist in order to merge her passions for science and art through the lens of movement. During her time at Temple, Laura has developed interests in both research and clinical practice. Her independent research study investigated student perceptions of exercise for individuals with non-communicable diseases, and she presented her findings at the College of Public Health's Student Research Day earlier in the semester. Laura is the recipient of the Hyman L. Dervitz Scholarship, which is awarded annually to a physical therapy student in recognition of their collaborative leadership and social conscience. After graduating, she will begin her career as a physical therapist, and this fall, she will also begin pursuing her PhD in Health and Rehabilitation Sciences at Drexel University, where she plans to investigate the biological and psychological factors influencing the development of musculoskeletal pain following neurologic injury, which sounds really fascinating. So please join me in welcoming our student commencement speaker, Laura Baer.
Hello, everyone. Welcome faculty, staff, family, friends, and members of the class of 2019 to the Temple University College of Public Health Commencement. I'm honored for the opportunity to share a few words to reflect on the meaning of public health as we embark on our careers in this exciting and challenging field. Public health has been defined as the science and the art of preventing disease, prolonging life, and promoting physical health through organized community efforts. By examining public health as both a science and an art, we acknowledge the undeniable relationship between the objective and subjective, the trend and the exception, the research and the human experience. We know that by incorporating the biological, psychological, and social factors of the individual into our practice, we provide comprehensive and compassionate care that truly can change lives. We are able to think critically about how we can help our patient, our client, or the population we work with. We consider not only the issues before them, but what their lives were like before they met us, and where they might go or where their futures might take them when they leave. In doing so, our interventions are not only based in clinical practice, but they're also informed by empathy and understanding. But this is a collective conviction that we all share now because of the Temple University College of Public Health mission to enhance quality of life for all by preparing us to contribute to health and social welfare. The collective we of this graduating class is made up of students in various stages of their careers. And when I say we, I'm speaking of graduate students embarking on professional endeavors, as well as undergraduates who are motivated by their commitment to public health through their work or their future education. This collective we could not be here today without the daily commitment that our talented faculty and staff make on a daily basis through teaching, research, and professional engagement in order to provide quality education and promote this vision. And while all of us graduating today are connected through this holistic philosophy of care, each profession and area of study represents a unique and imperative skill contributing to this approach. In addition to the core public health fields such as epidemiology, environmental health, social, behavioral health, and policy, the College of Public Health student body spans several additional disciplines, including exercise and sports science, kinesiology, as well as physical, occupational, speech, and recreational therapies, and nursing and social work. This list seems countless because the applications of public health are endless. It's a very good thing, considering the multitude of health concerns in Temple's own neighborhood, our nation, and the world. We have an overwhelming number of opportunities as future healthcare providers to address the biggest issues facing our field, including access to healthcare, mental health services, physical activity, nutrition, substance abuse, violence, and environmental quality. These are honorable but lofty goals that cannot be solved simply and perhaps seem insurmountable. But if we return to our understanding of public health as the science and the art of keeping people well as a community responsibility, then we know by definition our work is interdisciplinary. We have each other. We must strive to simultaneously provide best care in our respective areas of practice and recognize the limits of our knowledge so that we can rely on the expertise of our colleagues. We should remain grounded and accountable and motivated. We can use our interdisciplinary philosophy to create opportunities to learn from one another beyond Temple's doors, in our places of work, our practice organizations, and our communities. We should be compelled to challenge the boundaries of our specialties and look beyond the silos of our professions in order to improve the lives of individuals, communities, and the world. I thank you very much, and congratulations to the class of 2019.
Thank you, Laura, for your remarks. They were wonderful. So we're getting down to the main event. So many people in this room have made contributions that enabled our graduates to reach their goals. Will our graduates please acknowledge their family and friends with a round of applause? Next, I would like to recognize those students who have excelled academically in their studies and have received the highest honors bestowed on graduates. There are 3 levels of honors. The top 14% of graduates have earned the distinction of cum laude, the top 7%, the distinction of magna cum laude, and the top 4% of graduates, the highest distinction of summa cum laude. Will the students who have earned these honors please rise to be acknowledged? I would also like to take a moment to recognize the leadership of our college here on stage, including our associate and vice deans, department chairs who lead each of our college's 9 academic units, and actually Trustee McIntyre, who's with us today. I would also like to recognize our program directors, our faculty members, advisors, and other student services staff who support our students. And this year, could everybody that I just mentioned please rise so that they can be acknowledged? Thank you. Thank you. And lastly, I want to express my gratitude to those who made today's events possible, including Associate Dean Jennifer Ibrahim, Kimberly Wing, Mark Rowland, and many other staff, marshals, and student volunteers. We truly appreciate your time, your effort. This takes months in planning, so thank you. And now it is time to individually recognize our graduates. Our program directors will introduce each. There's a method to the way we're doing this. Each program director will introduce the graduates. There will be a photographer who will be recording the event, so please stay clear of the aisle. No taking selfies and videos as you walk across the stage. We had somebody who almost went off the stage once, only because we lunged and grabbed them. We don't want that. As a sign of respect for your fellow classmates, I ask our graduates to please remain present until all graduates have crossed the stage, okay? I want to emphasize that this is a really, really happy occasion, but it's also a solemn one as you cross from the threshold from student to graduate. So please conduct yourselves accordingly. Remember to be respectful. Remember, we have over 1,000 people to cross the stage, so please come, get your diploma, and then somebody at the other end will take a photo. No stopping in the middle and causing congestion like on the subway, okay? At this time, I invite our marshals to escort the first group of graduates who have earned a degree in occupational therapy to the stage.
On behalf of the Department of Rehabilitation Sciences, I'm pleased to present to you the class of 2019 graduates from the Doctor of Occupational Therapy program. Dr. Ala Abu Arab, Dr. Kristen Gill, on behalf of the Department of Rehabilitation Sciences, I'm pleased to present to you the class of Dr. Jamie McCulloch. Okay. On behalf of the Department of Rehabilitation Sciences, I'm pleased to present to you the class of 2019 graduates from the Masters in Occupational Therapy program. Emily Howard. Amanda Craig. Carissa Gagliano. Erica Hansen. Courtney Logan. Brianna Ciancolini. Darian Golden. Megan Allen. Cassandra Leonti. Laura Gallagher. Alexandria Pierce. Kalena Burnett. Katrina Levy. Kelsey Mitchell. Devlin Lawrence. Natalie Meadows. Morgan Morial. Laura Barone. Alyssa Carto. Lauren Skoll. Olivia Kopp. Megan Reed. Emily Manchik. Mary Beth Keith. Felicia Yebor. Haley Brumel. Kelly Wilson. Christina Neroni. Janice Euricchio. Remy Binder. Yakin Jabir. Nicole Hainel. Brittany Bowles. Vivian Hin. Yvette Hernandez. Jenny Lee.
On behalf of the Department of Rehabilitation Sciences, I am pleased to present to you the class of 2019 graduates from the Masters of Science in Recreational Therapy program. Fatima Ibrahim. Danielle Jens Rind. Kirsten Ferguson. Michelle Jaron. Jacqueline Strapacci. Varney Freeman. Adriana Viscomi. Victoria Negron. Helene Heron. Alice Jung. Courtney Casol. Jillian Pietroforte. Jessica Siepel. Amanda Patrolak. Allison Leopold. Bridget Bielowski. Mia Mecariello. Abriana Uten. Elizabeth No. Kevin Travers. Jasmine Bowlers. LaShira Glenn. Huidon May. Miranda Tan. Casey Green. Rihanna Reed. Catherine Kelly. Nicole Retorto. Nina Majewitz. Carrie Mahaffey. Kelsey Miller. Ariana Darnall. Emma Walton. Claire Ricevy. Sandra Michelle. William Evans. John Roboto. Kayla Falloon. Caitlin Brannigan. Caroline Francis. Rachel Albert. Callie Onakiavaj. Ava Gambucci. Megan Castleberry. Jessica Hetrick. Valerie Colantuno. Megan O'Neill. Julie Duffy. Abigail Miller. Lindsay Snyder. Kayla DeLeon. Ashley Opitz. Jessica Costanzi. David Tran. Alexandra Long. Capri Wagner. Jamie Vanderslice. Anna Tamaki. Felicia Madonna. Morgan Labs. Tamara Miller. Marley Patel. Drusty Patel. Kara Stratton. Bianca Harris. Natasha Rabinowitz. Lauren Haydusek. Anna Mignani, Veronica Doss, Cassandra Werner, Catherine McGinnis, Brooke Pagula, Alexis Principe, Eugene Hong, Ying-Chi Chen,
On behalf of the Department of Physical Therapy, I am pleased to present the class of 2019 graduates from the Doctor of Physical Therapy program. Joseph S. Pruitt, a Temple graduate of our physical therapy program in 1989, returned to complete his transitional DPT in 2016. Dr. Pruitt passed on July 10, 2018. His sister Carol Pruitt Jones will receive the DPT degree on his behalf. Hang on one second. Dr. Laura Baer. Dr. Teresa Payne. Dr. Shannon Stoltz. Dr. Caroline Hodgins. Dr. Danielle Del Archipreti. Dr. Lindsay Jones. Dr. Nicole Malone. Dr. Taylor Sherlock. Dr. Bridget McNeil. Dr. Lam Liu. Dr. Tanya Morris. Dr. Francine Seloa Mattis. Dr. Kelly Riggins. Dr. Molly Fenimore. Dr. Rebecca Shoup. Dr. Ian Edwards. Dr. Jonathan Bebby. Dr. Emily Opperman. Dr. Mia Salavanti. Dr. F.A. Osemiha. Dr. Catherine Weaver. Dr. Samantha Birmingham. Dr. Eric Montoy. Dr. Jeffrey Kurtz. Dr. Matthew Miraglia. Dr. Daniel Lamond. Dr. Andrew Chait. Dr. Jacob Lawrence. Dr. Robert Cardy. Dr. Nicole Notardonato. Dr. Giovanna Lee Fernandez. Dr. William Balsham. Dr. Leo Ma. Dr. Taylor Matzinger. Dr. Joseph Gelati. Dr. Michael Amol. Dr. Sam Kim. Dr. Bogdan Voschilo. Dr. Emily Phillips. Dr. Hannah Sondler. Dr. Jacob Robinson. Dr. Alexandra Cleary. Dr. Alexa Residlo. Dr. Allison Hart. Dr. Serena Ehrenberg. Dr. Emily Ellithorpe Luker. Dr. Amber Nallman. Dr. Sabora Schifrin. And Dr. Dorian Campisi.
Nope, I don't need that. Good morning. On behalf of the Department of Health Services Administration and Policy, I'm pleased to present to you the class of 2019 graduates of the Doctor of Health Policy program. Go ahead, step over. Dr. Mark Marsico. His dissertation was entitled Assessing the Impact of Pennsylvania's Prior Authorization Policy Intended to Reduce Antipsychotic Prescribing in Medicaid-insured Children.
On behalf of the Department of Health Services Administration and Policy, I am pleased to present to you the class of 2019 graduates from the Masters of Science in Health Informatics. Betsy Lau, Joel Laramie, Samara Shah, Elida Porter, Gloria Farn, Shu Han Su.
On behalf of the Department of Health Services Administration and Policy, I am pleased to present to you the class of 2019 graduates from the Bachelor of Science in Health Information Management program. Blanca Aguilar Lopez, Lauren Louise DeMassimo, Annalisa Selecchia, Stephanie Christine Rupa, Andrew Francis Wheatley, Warren Birch, Harmony Ann Redding, Courtney Leah Preisner, Sarah Elizabeth Golden, Shannon Nicole Blattner, Erica Christina Grooms, Brian Elise Knuckle, Crystal Denise Jones, Christy Yaboa, Brianna Jewel Hawkins, Kelly Renee Vampel, Yvette Evie Sabeti, Miad Ahmed Alfaki, Courtney Watrous, Sarah Burnick, Krupa Bhatt, Emma Jeanette Paluzzi, Eleanor Mavina, Detal Lee, Nung Kim Do, Jennifer Pham, Ray Henry, William Robert May,
On behalf of the Department of Health Services Administration and Policy, I am pleased to present to you the class of 2019 graduates from the Masters of Public Health in Health Policy and Management program. Kimya Ferranza, Priya Mehta, Kelsey Smith, Jacqueline George, Kayla Gray, Alexa Canizo, Willia Michelle, Emily Doherty, Mandy Smith,
On behalf of the Department of Epidemiology and Biostatistics, I am pleased to present to you the class of 2019 graduates from the Doctor of Epidemiology program. Dr. Alison Rini Casola, PhD in Epidemiology. Eliciting sexual and reproductive health knowledge and interpersonal correlates and predictors of contraceptive use behavior among young adults 18 to 24. On behalf of the Department of Epidemiology and Biostatistics, I am pleased to present to you the class of 2019 graduates from the Masters of Science in Epidemiology program. Samara Andrew. On behalf of the Department of Epidemiology and Biostatistics, I am pleased to present to you the class of 2019 graduates from the Masters of Health program. Erika Danihue. Sybil Andrew. Mackenzie Raab. Ryan Blunt. Nakota Briswell. Arjun Singh. Trevor Kanaski. Michael Pietrovsky. Pooja Tripathi. Preet Kamal Kaur. Albert Sitraresi. Henry Zobo. Gildas Tridanrabagago. Layona Baker. Sofia Rocha. Megan Miller. Aqua Darko.
On behalf of the College of Public Health, I am pleased to present to you the class of 2019 graduates from the PhD in Health Ecology program. Dr. Rachel Ellen Tinarelli. Her dissertation is entitled Examining the Relationship Between Early Life Antibiotic Exposure and Risk of Developing an Immune-Mediated Disease During Early Childhood Through Adolescence. Dr. Nadia Arella Glenn. Her dissertation is entitled The Meaning and Understanding of Unplanned Pregnancy, a qualitative study of unplanned pregnancy among African American women living with HIV. On behalf of the Department of Social and Behavioral Sciences, I am pleased to present to you the class of 2019 graduates from the Masters of Public Health in Social and Behavioral Sciences program. Arona Papad. Lauren Yap. Elizabeth Anwar. Diamond Hester. Gabrielle Steffi. Allison Bruff. Laura Beth McAllister. Brittany Blanchard. Jenin Alganam. Cynthia Roman Cabrera. Elizabeth Shagnon. Brianna Richardson.
On behalf of the Department of Social and Behavioral Sciences, it is my honor to present to you the class of 2019 graduates from the Bachelor of Science in Public Health program. Rosalind Smith. Maxime Derenoncourt. Briella Lugo. Diana Kamsingay. Ponpun Chanaran. Cheyenne Brown. Anna Minnick. Sabrina Torres. Ella Ardoin. Dion Smith. Crystal Anakam. Leah Aline. Ebony Killing. Chanel Daniels. Congratulations. Taylor Bridges. Trishana Stidman. Shelby Bree Johnson. Gisele Fajardo. Juliana Barron. Daniel Callahan. Giovanna Hannon. Aaron Stratton. Kimberly Strong. Julia Trout. Jessica Case. Alyssa Wenzel. Julia McNally. Colin Snyder. Jordan Soto. Samantha Starkey. Zoe Kay. Shannon Smith. Apurva Musty. Chloe Thompson. Xenia Lau. Maria Krawucki. Brenna Izquierdo. Nicholas Cook. Maya Bonifacio. Courtney Cunningham. Cassidy Tarullo. Gabrielle Gurian. Morgan Alter. Chidinma Obiakor. Tochiku Nwosu. Paunisha Smith. Alexandra Pierre. Paris Holiday. Congratulations. Brittany Young. Mary Iggy. Francesca Mendices. Sarah Weber. Lolita Robinson. Radhika Sinha. Congratulations. Megan Warren. Elizabeth Ahn. Paul Guinan. Emma Pitcher. Timmy Lynn. Congratulations. Tirza Shepard. Patrick Kelly. Jenna Bloom. Trenton Reardon. Congratulations. Olivia Vesey. Kirsten Chalupa. Carolyn Bresnahan. Gabrielle Combs. Venice Joey Salcedo. Sophia Genza. Nicholas Townsend. Alexandria Love. Congratulations. Marion Carter. Congratulations. Muhammad Lewis. Chelsea McNeil. Congratulations. Sarah Gibson. Dilvani Arredondo. Isatu Diawara. Anna Martin. Julia Ryan. Aaron Huter. Rebecca Elliott. Tierra Washington. Congratulations. Browdy Herrera. Congratulations. Tanya Dingra. Jiali Dong.
On behalf of the School of Social Work, it is my great honor to present to you the class of 2019 graduates from the Masters of Social Work program. Nicholas Bevich, Anna Arguedas, Julia Mead, thank you, Alexandra Smith, Carnita Washington, Tara Irons, Nashay Smith, Sadaya Lawrence, Daylin Ross, Zirconia Lake, Lisa Santafol, Jillian Naomi Sprucker, Ashley Torres, Rhonda Conwell, Rebecca Shepard, Sierra McNeil, Anna Cronin, Brianna Ranzino, William Higbee, Julie Colasanti, Mackenzie Koval, Carolyn Filipski, Molly Shank, Jenna Christensen, Megan Swavely, Mary Ellen Kane, Elizabeth Parks, Lisa Fleming, Nicole Stewart, Taylor Henry, Elizabeth Higginbotham, Shelley Smith, Tamika Rashawn Watson, Claire Pope. Jasmine Daniel McInnes Simonelli. Gregory Langan. Lindsay Anderson. Carrie Fitzpatrick. Adam Levine. Olivia Connect. Amber Jones. Shannon Graham. Veronica Rodriguez. Blessing Ohagabulam. Rachel Greenberg. Kiera Rasmussen. Samantha Lorenz. Ramira Habdi. Michael Collins. Dana Kellner. Jesse Telez. Patricia Coley. Gian Boyle. Orit Dogoshev. Catherine Kelly. Kristen Griego. Nina Stiens. Laura Velas. Molly Lindley. Angela Burns. Jolinda Ballard. Lisa Marcus. Sean Gallagher. Nose Poliard. Kimberly Hartzell. Elizabeth Kinder. Jeffrey Nesbitt. Ashley Yanni. Faith Sawyer. Merlanda Pierre. Kai Hardy. Rakaya Lash. Aaliyah Alexander. Janelle Crawford. Erica Mitchell. Darjane Naylor. Darjane Naylor. Latuan Getling. Yolanda Baker. Nuyoko Bansa. Victoria Figlio. Laura Nolan. Ashley Hercules. Melody Culp. Olamida Amosu. Brianna Stinson. Catherine Heidenreich. Mercedes Ledesma. Yusuf Hayes. Kayla Jasper. Sarah Kelly. Kareen Hedge. Shannon McCabe. Jasmine Sotomayor. Keisha Brooker. Danielle Rodriguez. Shavana Wilson. Aisha Bell. Marissa Kemp. Paige Kuhn. Angela Baker. Brittany Smith. Alfreda Davis. Brittany Fisher.
On behalf of the School of Social Work, I'm pleased to present to you the class of 2019 graduates from the Bachelor's of Social Work program. Emily Davis. Hanin Mustafa. Lisa Ha. Aaron Kane Rios. Eni Niana. Monica Ferry. Jennifer Chamberlain. Jalen Martin. Anna Rosario. DeMonte Fowler Thomas. Miriam Haj. Yasmin Latour. Megan Sabo. Sarah Bolden. Danea Otto. Sierra Huff. Brittany Baldwin. Mia Moore. Erica Dupriest. Amanda Longenberger.
We have one more MSW, Andrea Gaitan.
Kaylee Powell. Ashley McGlincy. Lawrence Perry. Ashley Ortiz. Rebecca Zimborski. Deja Savage. Jenna Luzier. Max Lomax. Bernadette Shipley. Marquita Abney. Lorpu Stevens.
Centeno. Sophanie Jacques. Aisha Abu Zaid. Jasmine Hatcher. Alina Centeno. Gerard Johnson. Melanie Santana. Melody Rowland. Tanika Chappell. Alexis Walker. Keone Hubbard. Jelena Sannon. Chad Gurgel. Ian McCoy. Brittany Rosanova. Ellie Wagner. Jessica Avalos. Sung Min Yi. Caitlin Kreck. Elizabeth Durning. Kiara Edlow. Michaela Smith-Cans. Kayla Warren. Kelly Leonard. Bethany Simon. Maeve Curley. Rachel DeMarco. Hannah Edelson. Hannah Spitz. Natalie Brand. Carly Schultz. Haley Conforti. Jessica Olson. Hannah Sarvey. Kara Persico. Emily McDevitt. Kelly Wilson. Andrew Buckland. Bren Deal. Kate Ryan. Ashley Reed. Albanera's Torres. Jasmine Smith. Marie Joseph. Lufan Lume. William Johnson. Tabitha Lanier. Christy Shamili. Ariel Sandler. Thomas James. Kian French. Leslie Delgado. Smith. Kia Wadora. Danielle Curcio. Joseph Carey. Joseph Robinson. Sierra Scott Thurston. Genesis Farley. Jose Farron Jr. Jobin Matthew. Sharon Coleman. Dion Bowie.
On behalf of the Department of Communication Sciences and Disorders, I'm thrilled to present to you the class of 2019 from the Masters of Arts in Speech, Language, and Hearing Sciences. Carolyn McIntyre, Nora Jackson, Derek Gower, Ryan Ellenbaum, Samantha Tucker, Tatiana Bereznikova, Sonali Shaw, Elisa Treber, Bridget McMenamin, Megan Donnelly, Patricia Cummings, Claire Golden, Nasia Williams, Lamira Archie, Kara Maniloff, Corinne Leach, Taylor Jackson, Jordan Dawson, Rachel Postomsky, Lisa Mincer, Nicole Conway, Carrie Lukanavich, Signe Moore. Congratulations.
It is a joy and an honor for me to present to you the graduates of the Department of Communication Sciences and Disorders who are earning their Bachelor of Arts degree either in linguistics or in speech, language, and hearing sciences. Casey Cope, Jacqueline Gordon, Swati Patel, Krista Scary, Courtney Jones, Miranda Corrigan, Sabrina Popa, Donna Montgomery, Brooke Foster, Kristen Bandholz, Casey Coker, Courtney Bradshaw, Cindy Atencia, Belena Ramirez Talavera, Giovanna Penza, Leanne Long, Larissa Bannon, Annie Chen, Andrea Ortega, Taylor Eximenes, Marlena Bowers, Tiana Stevenson, Carly Clayton, Olivia Werkheiser, Daniela Acosta, Muna Ahmed, Elijah Wilder, Michelle Ferguson, Stephanie Songer, Nicole Taflaferry, Mira DeTroya, Alexis McGoldrick, Joshua Peckman, Eddie Diaz Serrano, Maximilian Rooney, Samantha Wong, Shania Thomas, Chancey Cologne, Morgan Smith, Rebecca Valero, Jesse Ryan, Maria Zones, Catherine Wen, Kara Ozemkowitz, Caitlin Carson, Julia Vinitska, Zaina Greenlee, Hannah Bauer, Olivia Rosati, Stephanie Savoya, Cassidy Capola, Kelsey Walsh, Mia Ritter, Samantha Curran, Megan Schreiner, Sophia Gingrich, Zoe Costello, Nicole Servin, Marcy Frame, Caitlin Livingston, Ainsley Deepering, Bennett Daniels, Sanjana Jayaram, Kelly Sauer, Marissa Lazar, Claire Corbett, Laura Schaefer, Alana Waters, Jasmine Gulen, Crystal Savage, Takira Gothney, Sharon Campos, Victoria Lewis, Tatiana Bazil, Noah Weiss, Lauren Uvagis, Jessica Furlong, Shay McDonald, Margaret Driscoll, Gabriella Langen, Emma Musham, Victoria McCroning. Congratulations all.
On behalf of the Department of Nursing, I am pleased to present to you the class of 2019 graduates from the Doctor of Nursing Practice program. Dr. Eric Dutko. Dr. Grace Shaji. Dr. Mackenzie Palowski. Dr. Jennifer Onu. Dr. Dorothy Blanks. Dr. Jessica Vasquez. Dr. Maria Rudy. Dr. Roxani Mejia. Dr. Myra Underwood Rutland. Dr. Matthew Cibatoni.
On behalf of the Department of Nursing, I am pleased to present to you the class of 2019 graduates from the Bachelor of Science in Nursing program. Mandy Trong. Kira Sinatis. Sarah Phillip. Congratulations. Winshin Wu. Melody Kim. Min Win. Sarah Hurd. Jessica Yip. Yuri Zibrak. Andrew Choi. Oluwatosin Ojo. Cassandra Fox. Tracy Delgado. Ava McNitt. Elizabeth Tanis. Natalie Elegant. Amanda McDermott. Ronaldo Aldana. Catherine Campbell. Carolyn Dowdle. Juliana Doley. Julia Snyder. Melissa Uzinski. Morgan Sherlock. Jenna Skolis. Marcia Legone. Mario Calabani. Brianna Weirden. Dawn Silligan. Maxwell Koglinski. JR. Christopher Baker. Matthew Gladfelder. Michael Nolte. Margaret Hofstetter. Elizabeth Reiner. Courtney Winfen. Molly Apple. Lauren Griffin. Alexandra Batista. Amanda Kuwait. Faith Pavano. Zoe Permarter. Rosemarie Taylor. Abigail Shunk. Veronica Bogdansky. Julia Bonkos. Julia Bonkos. Keely Cunningham. Tatiana Keys. Gabrielle Evans. Melanie Susky. Sydney Hall. Adriana Monto. Jamie Matis. Elaine Hoy. Grace Francisco. Christopher Brown. Megan Horensky. Sydney Tuma. Allison Cody. Galia Colliner. Brielle Balecki. Madison Centofanti. Hannah Recchia. Kathleen McConney. Aaron Edling. Bridget Davini. Tyler Rudy. Ray Ramslin. Jillian Capella. Megan Hanlon. Ashley Walsh. Christina Gabling. Denny Craig. Danielle Brodeen. Maylu Toure. Nicole Winterbottom. Amy Top. Lindsay Matthew. Nikita Patel. Brianna Daly. Ilana Roman. Laura Casme. Brooke Morris. Allison Hughes. Catherine Burke. Courtney Hatton. Lauren Lau. Kelsey Luck. Emily Robinson. Lauren Marshall Kane. Jacob Spees. Chelsea Holgreen Comerford. Shannon Duffy. Nawal Hussein. Sarah Zakin. Victoria Sellers. Catherine Schaubel. Kara Kirby.
On behalf of the Department of Kinesiology, I am pleased to present to you the class of 2019 graduates from the Doctor of Athletic Training program. Dr. Helen Gallagher. Dr. Tara Hannings. Dr. Michael Douglas. Dr. Brianne Vincent. Dr. Jonathan Hochstetler. Dr. Ryan Wagner. Dr. Joseph Davis. Dr. Masahiro Takahagi. Dr. Catherine Haynes Romano. Dr. William Rell. Dr. Melissa Jack. Dr. Adriana Rodriguez.
On behalf of the Department of Kinesiology, I'm pleased to present to you the class of 19 graduates from the Masters of Science in the Kinesiology program. Sarah Hoder. Destiny Grove. Jacob Powell. Catherine Thomas. Tasia Kenny. Osana Baye. Ian McGinnis. Morgan Wombold. Brandon Straley. Nicholas Patamas. Julia Leiterman. Marcus Hawkins. Kyle Prescott. Kayla Karchner.
On behalf of the Department of Kinesiology, I am pleased to present to you the class of 2019 graduates from the Masters of Science in Athletic Training program. Whitney Carter. LaShonda Patuk. Reagan Oliveri. Tyler Damon. Megan Cullen. John Presas. Keith Ryder. Liam Corbel. Will Eston. On behalf of the Department of Kinesiology, I am pleased to present to you the class of 2019 graduates from the Bachelors of Science in Athletic Training program. Thomas Gallagher. David Bailey. Nicolette Branson. Ayanalua Alange. Jeffrey Jacoby. Melissa Mazzatelli. Monica Wadsley. Natalie Hackett Abuhawa. Micah Paschel. Orlando Robledo. Perry Bowers. Katana Payne. Lauren Palco. Miranda Doyle. Hannah Shade. Erica Winter. Heather Kilduff. Alyssa Sacco. Deanne Lee. Megan Bobish. Maria Market. Riley Kropp. John Waldinger. Maxim Zhitoski. Christopher Rojas. John Ballinger. Dr. Elizabeth Diane Thompson, PhD in kinesiology. Dissertation, Improving Walking in Individuals with Parkinson's Disease Through Wearable Technology.
On behalf of the Department of Kinesiology, I'm pleased to present to you the class of 2019 graduates from the Bachelors of Science in Kinesiology. Kinshu Patel, Elizabeth Coughlin, Jordan Trekner, Hannah Vandergrift, Christina Kukakowski, Ayanna Malcolm, Brianna Larkins, Courtney Myers, Autumn Johnson, Kristen Charity, Charisma Cherukuri, Dion Carmichael, Amrit Kaur, Edward Piarco, Drew Kang, Christopher Hammerstone, Jessica Schreck,
Thank you.
Alexis McCarthy-Preet, Alexis Vega, thank you. Rachel Fenstermacher, Catlin Bookies, Danielle Williamson, Anna Massione, Sam Liu, Stephen Tweed, Rhiannon Hickey, Kristen Graham, Elizabeth Klein, Brooke Frankenfield, Olivia Downey, Dallas Vaughn, Lisa Curley, Kadeja Lewis, Johnny Tamney, Danielle Kerr, Sugako Campbell, Tao Vai, Robert Al, Samantha Piazza, Maria Elena Corretzos, Megan Parabek, Michael Milligan, Jesse Sama, Avin Matthew, Jason Roldan, Tyler Millhouse, Dominic De Laurentiis, Timothy Breslin, Nicole Christensen, Denise Lane, Brielle Artis, Cassandra De Los Santos, Jessica De Domenicis, David Goodman, Madeline Seiden, Stephanie Connor, Allison Cullen, Hannah Moyle, Francesca Gallo, Bailey Leslie, Morgan Fridley, Seamus Fitzpatrick, Sean Mann, Darian Drugatz, Amber Gunn, Jade Carazza, William Kaiser, Hiromi Albright, Regine Riggins, Prina Nahar, Tessie Phillip, Emily Wells, Sean Golas, Timothy Riley, Sheridan Mabin, Lauren Richards, Leah Gruel, Kira Sloan, Mirva Modi, Alexandra Bashar, Jamie Kerrigan, Alexa Atlan, Lauren Stern, Nicole Amoroso, Nicole Scatular, Daniel Lay, Tu Quach, Jerry Mark, Dong Lee, Brittany Fitch. Mayana Mia. Adrian Hopkins. Ciara Manning. Tyler Rutsidlo. Robert Rera. Colleen Wiley. Giorgio Papas. Catherine Nguyen. Brett Dayhoff. Palash Niloy. Sean Matthew. Shivani Patel. Sarah Fidel. Amber Lynch. Ariel Hunt. Carly Thomas. Pretty Aurora. Bramati Papastafio. Allison Sanborn. Malia Chowdhury. Gabriel Mars. Adam Novak. Carter Crowley. Michael Nguyen. Adam Snyder. Alexandra Luneman. Jose Antunez. Derek Madison. Mackenzie Dalbert. John Poza. Allison Stratton. Catherine Genuino. Jessica Din. Jenny Lynn. Marvin La. Aditi Patel. Nikita Shah. Dara Raj. Heiji Lee. Sunny Cho. Sabrina Yakubovich. Noor Shoaib. Pranita Kumar. Jada Nicole Goodson. Jenna Hanukkah. Aisha Gaffney. Naomi Ocean. Alexis Carter. Shantia Horsford. Zukiswa Jwili. Keenan Waltemeyer. Alec Berenbaum. Unique Jones. Gulistan Zavali. Sarah Gronwald. Nadia Alashush. Leanne Santo. Marta Tsikidis. Danielle Walter. Brianne Barnes. Jolynn Miller. Kimberlyn Orejuela. Menderes Dung. Brianna Thomas. Connor Smith. Cortland Raines. Kelsey Hershey. Morgan Quezet. Matthew Williams. Megan Coder. Caitlin Sheasley. Kara Ramage. Juliana Mangan. Kylie Hill. Elizabeth Milbourne. Hannah Simon. Heidi Schmidt. Alex Graham. Elizabeth Hoffler. Brittany Klimitsakos. Austin Zvelenek. Evan Yarnall. Andrew Collins. Samaje Harper. Megan Graham. Brittany Fowler. Megan Fowler. James Canini. Samuel Maxey. Anthony Bados. Bill McCarty. Allison Calvo. Sean Chandler. Proper Mikoba. Princess Kuteyu. Mariana Jalal. David John Ladignon. Sarah Methai. John Kaminsky. John Contessa. Brenna Pelletier. Gabrielle Lawson. Jonas Jean-Claude. Chester Utuk. Cole Boxleitner. Cameron Weiss. Almudena Hidalgo Baeza. Madhuvanthi Ganesh. Lan Tran. Mitchell Choi. Raymond Chu. Cinquetta Blackman. Janula Botsari. Olivia Blackton. Kylie Tomlinson.
Thank you.
Amit Shah. Neoma Onichu for everything.
Well, congratulations to all of our degree recipients. And now we're going to prepare to recess. So I'm going to ask everyone to stay seated until the stage party has left the arena. The marshals are going to direct the students on how to leave. I ask the family and friends to follow the directions of the Liacouras staff to exit onto Broad Street or onto 15th where you can meet your new graduates. Trust me, we will get out of here a lot quicker if we do it that way. We've had the experience. So, this concludes the College of Public Health's 53rd graduation ceremony. I thank you all so much for coming. Thank you to the graduates. Thank you to the families.